I'm an inspector on the infectious disease team and have the pleasure of introducing our next presenters, which are Tim and Robin. Tim Hagerman is a public health inspector and has worked in public health for 20 years, and right now is working on the infectious disease team. Robin Latendresse is a public health nurse and has been with Southwest Public Health for 19 years and on the infectious disease team for the last 13 years. And they will be reviewing some of the outbreak resources for congregate living settings with you now. I'll let Robin and Tim take over.
Okay, thank you, Martha, for the introduction. So my name is Robin, and I'm one of the nurses on the infectious disease team, and I'm going to get us started and hand it over to Tim to go over the first part of the presentation. So just briefly before I give it over to Tim, the outline for today's session, we're going to be talking about ways to recognize an outbreak. So just different methods that should be in place at your facility to quickly detect a potential outbreak. Tim will be reviewing that, and he will get into when and how to report outbreaks to Southwestern Public Health, and then I will take over to discuss outbreak resources. And if we have time left over at the end, please feel free to unmute or type questions in the chat box if you'd like to get into more details about the outbreak management strategy. So they're not part of this presentation, but we are able to answer those questions at the end.
Perfect. Thanks, Robin. So recognizing an outbreak, so monitoring clients for new symptoms every day should start to be commonplace now. We've been doing when outbreaks, BID, but if you're not in an outbreak situation, monitor new symptoms and whatnot every day. And well, how are we going to do this? Well, similar to a line listing, we have a daily illness form, which you'll see in a moment. And that has a wide array of symptoms on it, not just respiratory, so that you can track various potential illnesses in the home. And then call public health if there's a cluster of cases. So if you have a cluster, more than one client with similar symptoms in a short time frame, in a close geographic area of the home, then you want to be calling public health. Talk about it. So here's the sample daily illness form. As you can see, it's got a place for urine, for UTIs, and chest X-ray, pneumonia, chest X-ray confirmed pneumonia, and things like that. Do whatever works for your facility is what I usually say. These are examples, and most places just take the ones that we provide and run with it. But I always say if there's a system that you have in place now or that you'd like to put in place, does the same thing as tracking the illnesses, then stick with that. And I just wanted to also mention a lot of the homes I deal with, they have 3 to 5 residents and things like that. So you might be wondering, do we really need to do this when we only have 3, 4 residents and whatnot? The answer is yeah, because you may only have 3 or 4 residents, but think about the staff. So somebody's finishing off their shift. I don't know about you, at the end of the day, tired, you want to go home, you give a brief update, and off you go. And then now we have new staff in there. So it's not so much, I don't look so much at the number of residents as the staff as well. So the staff are not going to be able to recognize an outbreak, even if there's 3, 4 residents, just if if you have a high number of different staff coming into the home. So by definition, an outbreak is a sudden increase in the number of cases. And a confirmed COVID-19 outbreak, so this is right from the guidance documents. In congregate living settings, defined as 2 or more clients with a common epi link, each with a positive test, either the molecular or the rapid antigen within a 10-day time frame. Now, there's two things I wanted to mention about this definition. You notice common epi link. Well, if you have residents living in the same home, that's your epi link right there. However, if if you have one positive case and I'm the second positive case, but I tell you that I was out visiting my family and I was shocked my sister had COVID and she was over, blah, 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 blah. Well, then obviously there's an alternative explanation for the etiology of my illness. So as I say, we would look at everything. We wouldn't just call an outbreak at hitting the magic number of 2. Although if there's no other epi link other than the facility, then I likely would. And outbreak under the HPPA, Health Protection and Promotion Act, outbreaks in institutions must be reported to the local public health unit, and an outbreaks COVID-19 or any disease of public health significance as well must be reported to the local public health unit. So when to report, as soon as an outbreak is suspected, and I'd also add in there if you have any questions. So for example, if you had somebody that had chest x-ray confirmed pneumonia and the physician maybe mentioned, I thought perhaps it was Legionnaire's disease. Give us a call, talk to us. It may be something, maybe nothing. But so you don't have to wait until you're sort of suspecting like there's a big problem. You can always call and talk to us about what's happening within the facility. And obviously, early detection is key, both in terms of the controls that Leslie and Paige went over, engineering controls and everything. And also now that we have Paxlovid, and if there was influenza, we have oseltamivir. So we have effective antivirals, but the window of opportunity is very narrow. So that's why it's important to get things to recognize an outbreak as soon as possible. So reporting an outbreak. So during regular business hours, St. Thomas site, extension 1232, and the Woodstock site, we have a different phone number, extension 3500. And then after hours, weekends and holidays, we can call that number, and our answering service will come on, and we'll get the on-call inspector for you. We will be more than happy to help you out. And we also have a new online report form, and there's the link right there, and you can go to that report form to notify us of potential outbreak. I didn't know if you wanted to say anything else about the form, Robin.
No, it's a new form that we've just created this new process where you can report to us online. You'll go on, if you click the link, you'll have to find your facility name, and then you'll be prompted to provide us some details about the suspect outbreak that you're reporting. So we'll just, there's a few questions that you'll be asked that we'll want to gather that information. And then if possible, we'd encourage you to upload a line list. So as Tim had mentioned, when you do have residents with new infectious symptoms, if you're tracking those on an outbreak line list or a daily surveillance list, that's great. So one excellent way to determine if you have a cluster and a potential outbreak, we'll ask you to provide that line list information to us. And then the health unit staff that you normally work with at the health unit will review that information, get back to you to confirm next steps. So we'll determine if it is a confirmed outbreak or if it's just a situation that we need to keep a close eye on. And we'll share some control measures and further direction, in terms of, all of the the case management and with COVID contact management recommendations. So it's just a new process, and it helps you just to provide a quick summary of what's happening for us to review, and then we'll get back to you to discuss in more detail. And it can be used, during regular business hours and after hours. And it will be reviewed again by a public health staff who will get back to you to discuss next steps. Okay, so moving along, we're now going to get into the presentation where we're going to look at some of the outbreak resources. So on this first slide, I have a screenshot of the outbreak line list that we've been referring to a little bit over the last few slides. So this is something that you may be familiar with if you've had a suspect or confirmed outbreak. We generally, as a health unit outbreak investigator, we will share a blank copy of this line list with you, a template that you can use to track your new cases, symptomatic staff or residents. And this particular line list can be used for respiratory and enteric outbreaks. And by respiratory, it might be COVID, it might be something else. And also if you have any potential enteric outbreak situation occurring. So that would be, residents with vomiting or diarrhea. Of course, you can track them on here. And I know we're on high alert for COVID, and those symptoms might be COVID related, but it might also be something else. So this list works well for both of those types of outbreaks, the respiratory and enteric. And it can be used for tracking staff and resident cases. The template copies are available on the website, and I'll take us on a quick tour of the website in a few minutes. Okay, and next I just have a screenshot of the outbreak control measures. So we do have respiratory outbreak control measures for both confirmed and suspected respiratory outbreaks, in addition to a separate list of control measures if we have an enteric outbreak occurring. Now, these ones here that I have a screenshot of are specific for our long-term care homes and retirement homes. However, we do have some that were developed for other congregate settings. So our group homes, assisted living facilities, we have a version that is very specific and tailored to meet the outbreak needs and recommendations for your settings as well. And they will be posted on our website in the near future. So the congregate setting outbreak control measures aren't available online yet, but they will be soon. And if needed, if you have a situation that involves, implementation of any outbreak control measures, they would be provided to you directly when you call us to discuss the situation. Okay, and then I was going to highlight some other outbreak resources that we have online available for download. And again, this is right now on the long-term care home and retirement home section of the website, but these posters are, it can be used for a variety of different settings. And I've just taken a screenshot of a few of the posters that we have. So there's outbreak posters that might be needed if you are in an outbreak, just to notify anyone who might be attending your facility that there's an outbreak an active outbreak in the facility. We have a variety of different hand hygiene posters that of course can be used and should be up regardless of whether or not there's an outbreak at the facility. We have some, cover your cough posters, physical distancing posters. There's many different posters that we have online. And we have additional precautions posters as well. So I've just taken a screenshot of a few of them, but I just encourage you to look and download any posters that you're interested in and print them. Now, having said that, we are going to be preparing a small outbreak package that will be available. If you would like to pick up resources, you can just drop into the St. Thomas site or the Woodstock site to pick up an outbreak package, and that will include a variety of different posters and some other outbreak resources. But again, they're available online if you'd like to download and print. Okay, so this slide here, I'm going to just take us on a quick tour of the website, and it's going to open up to the Congregate Living Settings section of our website. And the way that you can get to this, if you're Googling the health unit and you get onto the website, you'll want to go to the top menu bar, and under the section called Partners and Professionals, you'll see down below, there's a variety of different materials available for different sectors, and Congregate Living is the page that we're on right now. So you click on that, you get to this web page here. And if you haven't being on the website to check out our resources. We've got lots of different materials here. All of the COVID guidelines are within that first section titled COVID-19 Guidance. We have a wonderful section with a variety of different IPAC resources. Many of the resources that Leslie and Paige reviewed during their presentation will be available in the IPAC section of the Congregate Living Setting page. Oh, and the downloadable signs are also right here on the Congregate Living Setting page. And the one section that's coming soon, so not quite here yet, is the Outbreak resources. But if you were interested in looking to see what we have, you could, of course, go into the long-term care home section. And we do have an Outbreak page here that kind of goes through some of the outbreak basics, just as Tim had gone through, how to determine when an outbreak's occurring, what is an outbreak. So there's general information about outbreaks, plus provincial guidance documents and our local resource tools. So I'm scrolling down a little bit quickly here, but this is the section that I wanted to point out where you can find the template copies of the control measures. And again, these are specific for long-term care and retirement home, but the line list templates are here and available to you if needed for tracking resident cases. Yeah, and then there's just a variety of other materials. So if there's anyone who has any questions about the Outbreak resources or the website, please let us know when we get to the end of the presentation. I'm going to jump back into the presentation and skip along to the next slide here. And Alicia had discussed outbreak testing. So on here is just a reminder to ideally have some supplies on hand should your facility go into an outbreak, or if you have any symptomatic residents or clients and we need to do PCR testing, because it is the best practice for anyone with symptoms that lives in a high-risk setting is to do PCR testing for confirmation. So having some of those kits on hand is a wonderful idea. And of course, during an outbreak, we would be supplying you with some kits as needed to meet your testing needs. So here is just the contact information again for the health unit. If you needed some kits to have on hand in advance, or if you're calling to report a suspect outbreak, you can reach out to the person that you normally deal with. And if you can't get a hold of them, to reach one of the other members of the team, the contact extension for St. Thomas is 1232 or 3500 in Woodstock. And of course, we could chat with you about suspect or confirmed outbreaks and management, and that would include specimen collection and transport. Okay, and then this next slide here, just again, highlighting some of the provincial outbreak guidelines and resources. And I know Joanne had covered some of this in her presentation. So we're very familiar over the last couple of years with the COVID outbreaks and COVID outbreak management. So that's the first resource here that was updated October 6th. And that's the day that the document was combined to become one document with the retirement home and long-term care home COVID outbreak guidelines. So the link is there. And then I wanted to also point out, as Joanne had mentioned as well, there's a COVID antiviral screening tool available on the provincial website that will just assist in the decision-making process if you've got a resident or a client with new symptoms, particularly if they have had a COVID positive result. It will just assist you in determining if they are eligible for antiviral treatment. And again, as Tim had mentioned, the sooner it started, the better. And ideally within about 5 days, if we're talking about COVID, and much sooner if we're managing flu. But the screening tool is there, and those are conversations that would occur between your facility and the physician of that resident or client. So we just encourage, as soon as we suspect or have confirmation of COVID infection, that you reach out to the resident's physician as soon as possible to discuss the antiviral treatment. And that's just one tool to assist you in determining if the client is eligible. And then I've also included, just as a reference, there's other outbreak guidance documents that public health has been using for quite some time. And these are for other respiratory outbreaks. So our flu and other respiratory viral pathogens, or even an unknown respiratory pathogen outbreak, we would refer to these outbreak guidelines here that I've posted the link to. And then Enteric, they have their own set outbreak management guidelines. Okay, and then a few more provincial guidelines, and this here again is just to highlight some of the information that Leslie and Paige have shared, some Public Health Ontario IPAC resources. So there's a great toolkit, the IPAC Action IPAC Activities that was produced in August of 2022. So a relatively new resource that goes through all of the different infection prevention and control activities, and ways to assess and audit those activities within your home. So I really encourage you to take a look at that document. And then just a few other resources that we've been using for quite some time, information about cohorting. And again, this is very specific to COVID outbreaks. And then we've got a whole page dedicated to COVID outbreak resources and IPAC resources specific to COVID on the Public Health Ontario website. And then lastly, and this is again, we have this information on our website as well, it's the additional precaution sign. So if you do have any residents in isolation because of an infection and you need to communicate that clearly with staff, we encourage you to post your additional precaution signs on the resident room door. Of course, it's just going to give staff a little bit more visual that additional precautions are needed when entering the room. We don't put the diagnosis or anything like that on the door, but just something to say what precautions are needed when you're entering that resident room. Okay, and skipping along to, I think this is my almost the last slide here, and this is immunization resources, and our vaccine team is going to present next. But I'll just highlight quickly that there are some great immunization posters and campaign materials on the Immunize Canada website. The first one that I've included on this slide is around influenza immunization. And then there's some information about influenza and pneumococcal awareness, as well as just some general adult immunization materials.